Good evening, I'm Courtney Jerome, and welcome to Ask the Specialists. Tonight, we ask the doctors right here on CMU Public Television. Thank you for joining us tonight on Ask the Doctors. Our whole conversation in this live program revolves around you. We're inviting you to submit your health-related questions via our 844 number or via social media, and those questions that you have will be relayed to our doctors that we have with us, joined live in studio. And really tonight we are concentrating on the not only just general health questions, but on allergies, as it's springtime and a lot of us are being affected by this time of year, and we have a lot of allergies going on. So again, we welcome you to submit your questions tonight so we can ask our doctors live. You can call our 844-975-3343 number, or you can get your questions in via social media. Our Facebook page is facebook.com/askthespecialists, and you can also send us a question via Twitter. Our handle is @WCMU_AskThe. Now, when you submit your questions tonight, we will be asking these two gentlemen. Thank you both so much for being here tonight.
Thank you.
Thank you, Ray.
Okay, well, we'll just start off with Dr. Horrible. Can you please describe your background and your areas of expertise, especially when it comes to allergies?
Yes. I'm Jonathan Horrible. I went to medical school at Michigan State University, and then I did an internal medicine residency at Henry Ford in Detroit, and then finished up with an allergy fellowship in Cleveland, Ohio at Case Western University.
Okay, and now you are based in Midland.
I'm based in Midland and Bay City.
Okay, excellent. Well, again, thank you for being here tonight.
Thank you.
Okay, and then sitting next to you, we have Dr. Calliphora. Thank you as well for being here tonight.
Thank you very much.
Now, you are an internal medicine specialist.
Yes.
Can you describe to our viewers what exactly that means?
Internal medicine is basically a specialty where we take care of adults more than 18 years old. I would say anything under the sky, any problems for people who are 18 years old. About myself, I am an Indian medical graduate. I did my medical school in India in Academy of Medical Science. I did my residency in New York, Woodhull Medical Center, which is affiliated with NYU. I'm working for Mid-Michigan Medical Center, and I'm an internal medicine physician in the campus ridge office there.
Okay, perfect. Well, thank you again for being here tonight. Yeah. Now, as you just heard, our doctors tonight are definitely experts in their areas. So please give us a call, 844-975-3343, to ask them your medical questions, or head to one of our social media channels to type in your questions there as well. I guess if we could just start off a little bit about allergies, some nice general overview of, what causes an allergic reaction.
Yes, absolutely. Well, tis the season, except for the snow we saw this morning covering the ground. Allergies are seasonal, so they come up, every year. Every year you get the hay fever in the spring, caused by tree pollens, and then extends into the summer, caused by grass pollens, and then finally by weeds into the fall. Allergies are hypersensitivity to the environment. So whereas a person who doesn't suffer from allergies looks at a tree pollen or a grass pollen and their body doesn't react, individuals with allergies, they tend to have a more hypersensitive reaction from their immune system to those pollens.
Okay. Now, what are the most common pollens that are out right now?
Currently, we are about to be exposed to some tree pollens, but we're also always experiencing mold pollens. And anybody that has cats, dogs, or is inside during the wintertime notices that they can also get allergies from indoor symptoms too.
Okay. Good to know. Excellent. Well, we have a great follow-up question to that nice general overview of allergies. This is coming in from Sears. She's asking how testing is done for allergies.
Testing. So testing is really done in two general methods. So there is the gold standard method, which is the skin testing. So depending on the age group, we do skin testing where we actually put the antigen itself, so trees or grass or ragweed or cats or dogs, on your back and find out if you have an inflammatory reaction to this. That's really the gold standard as to figure out what you're allergic to. Some individuals can't tolerate that due to skin diseases or other factors, and we can also use blood testing. It's not as sensitive of a test, it's more specific of a test. So I can tell whether you're allergic to a long-tailed black cat or a long-tailed red cat. But it might not always show exactly what we're looking for, and that's why we always result, that's why as an allergist I always resort to the gold standard of that skin testing.
Okay, now is that skin testing, is that done by shots?
It is, some parts of it is. So the beginning of the test should be done with little scratches. So we put little drops on your back and we do itty bitty little scratches. If those do or don't come up, we can then decide to do what's called intradermal injections, and that's where the doctor should take a little itty bitty needle and do kind of a little TB test underneath your skin. It's not painful as everybody describes as getting, you know, your vaccination shots or things like that. It's just a little itty bitty poke underneath the skin.
Not painful.
Shouldn't be.
Good to know.
Shouldn't be.
Good to know. Excellent. And I like that you brought up vaccinations, because we have a caller who has already called in and asked for a little bit of information specifically about the measles vaccine as an adult. And he was asking if when's the best time as an adult to get that measles vaccine?
Okay. Measles vaccine are generally given as during the childhood, like usually around 5 months age. So once the vaccine is done, it's supposed to be good for the rest of your life. But there are some kids who haven't got the vaccine when they were a kid, and they should be getting normal measles measles series at that time. So for an adult, in general, there is no recommendation for a measles vaccine.
Okay. Now, how about some other vaccines? What are some of those that do require boosters as you're an adult?
We recommend tetanus and pertussis vaccine, which is a combination of diphtheria, tetanus and pertussis. We call the Tdap vaccine, which is recommended every 10 years. The hepatitis B vaccine, so far there was a practice we were giving it every 10 years for healthcare providers, but it is not routinely recommended. Pneumonia vaccines for immunosuppressed patients, we give it before when they're before 65 years of age, and after 65 years of age they need to get pneumonia vaccines. Now there are 2 pneumonia vaccines. One is Prevnar, and the other one is Pneumovax. So that's pretty much.
Okay, now say someone has forgotten when they received their last booster, or they have changed from medical offices and they're unable to get their records. Is there somewhere where they can call or look up really what their personal record is on those boosters?
So Michigan State does a good job. They have a state registry where they document the vaccination. So many a times when patients come into my office as new patients, we were able to pull up their records. But in general, vaccines are not a very harmful thing. Nothing bad is going to happen if somebody gets a booster vaccine earlier than supposed to be.
Okay. Yeah. Excellent, thank you. Now, this viewer is from Traverse City. She is 84 years old, and I'm not sure who exactly to direct the question to, so perhaps we can kind of tackle it from both of your perspectives. For the last 10 years, she has what looks like a brown rash on her ankles and her leg. She's curious as to what it is. It looks like it's on both of her legs, and she can't wash it off. So maybe it could be a permanent allergic reaction or something more. What are your thoughts on this?
I think this sounds more like a Dr. Calliphora type questions, although I can add a little allergy afterwards.
Okay, perfect.
Yeah, allergies on the ankle area. A lot of times we think about contact dermatitis. Maybe they're allergic to some new footwear they're wearing. A lot of rashes, unfortunately, cannot be diagnosed just by hearing about it. A lot of them, what we call is a spot diagnosis, where we have to really see the rash to really figure out what exactly it is. So unfortunately, I don't think I can be of any more help about that.
Okay. So with regards to that, looking at her age and general background, I'd want to make sure that her heart's looked at to make sure that that's working well. So I think she should follow up with her family practice doctor to figure that out. But as Dr. Calliphora was saying, she can have what's called a contact dermatitis or an allergy to something that she's actually touching.
Okay.
If she wishes to investigate that further, what she needs to do is called patch testing. And that's where you apply a series of patches to the individual's back and actually watch them over a few days in a row to see if they actually have an allergy to something, some sort of chemical that they're being exposed to that could cause a rash that could resemble that.
Okay, great. Thank you very much. We are receiving a lot of questions tonight. Let's get to another one here. This one is about hip replacement. Looks like our caller, she had a hip replacement and then she fell. Now she's having a lot of problems and she's thinking possibly some nerve damage. They want to do exploratory surgery. Is that something that you would recommend as well?
It depends on the situation, actually. If somebody who had a hip replacement fell, sometimes the prosthetic joint might have dislodged or dislocated, and it depends on the severity. It's a case by case. Not everybody requires exploratory surgery, but I would defer that recommendation to the specialist who is taking care of her already, and I think that probably he has made a good choice for her.
Okay.
Yeah.
Okay, thank you. Now on to the topic of osteoarthritis.
Okay.
I know a lot of our viewers are probably experiencing this. What are some things that the average person can do to help with it?
Osteoarthritis is a degenerative joint. Technically is a wear and tear of the joint. Okay, so technically it comes with age. Osteoarthritis is most commonly seen in senior citizens. There is nothing much to prevent it. A lot of times, increased osteoarthritis can be seen in people who are exposed to a special kind of work or job. So basically, the management is to control the pain and maybe wear good shoes and things like that. Ultimately, if the pain is getting severe and the pain management is not pain medications are not helping with the pain, eventually a lot of people get joint replacements.
Okay, here's another arthritis type question. This one coming in from Charlevoix. Looks like our caller is having tingling in their left hand at 63 years old. They're wondering what kind of diagnosis it could be and the potential treatment. Now I know it would be really probably beneficial to see them. So maybe just a nice general.
Yeah, tingling in the hands. Typically, we see a lot in carpal tunnel syndrome. It will be typically in the thumb, index, and the middle finger. But it's just by hearing that symptom, I cannot really pinpoint that it is carpal tunnel syndrome. Mm-hmm. It could be something else too. But for that, she has to be seen by a physician and evaluated.
Okay, thank you. Now, Dr. Horrible, an allergy-related question for you coming from Gladwin. Mm-hmm. If you have a reaction to a bee sting, what should you do?
That's actually a good question. With the springtime comes bees. And individuals that are exposed to stings can have actual hypersensitivity reactions to the point where it can actually hurt and almost kill them. And what they need to have done is be evaluated by either the primary care physician or an allergist to see if they need to be evaluated further. If there are any sort of systemic effects, difficulty in breathing, dizziness, heart palpitations, hives, any place on their skin, they really do need to be evaluated by an allergist using testing. So the testing that we talked about before, where we did those little scratches on your skin and then little intradermal needles underneath your skin. Knowing that, you can determine whether the person would benefit from immunotherapy, which is a desensitization to the bee sting itself, which improves your survival symptoms 95% over the individual. Now, the problem with this is that after you get your first sting, you might be okay, but there's a 70% worsening rate to getting the second sting. So after your first sting, the second sting, you might have a 70% increase in systemic effects.
Okay.
Also, individuals that have been stung and have those types of effects should always carry an EpiPen if they're ever stung by accident again.
Okay. What a very thorough answer. Thank you very much. This caller is from Gaylord. He is a 72-year-old male, and his question is, what do you do for an overactive thyroid?
Okay, overactive thyroid is mainly increase in thyroid hormone production by the thyroid gland. There are many causes for it. Management sometimes depends on the cause. There is a treatment called radioactive iodine treatment where they inject a medication and they kind of is absorbed into the thyroid gland and it destroys the thyroid gland and then it decreases the amount of thyroid hormone production. It can be managed surgically by taking it out. So those are the most common ways. It has to be managed. There are some medications too which can decrease the thyroid hormone production. It's called methimazole. So the way how it has to be treated, it depends on different things, which has to be tailored patient by patient.
Okay, thank you, Dr. Calliphora. Now, we have a lot of questions coming in via our phone number, but we also have some coming in via social media. So we'll head over to our social media channel right now. From Facebook, we received a question about as we age, many medications that once took care of the symptoms no longer work. How can we find something that will?
It's a very difficult question to answer, actually. Our body develops something called tolerance, where the medication gets less and less effective. We see that a lot. A lot of times we have to switch around with medications when that happens. But a lot of times we can get around and find a better medication for that particular patient.
And we see that a lot in allergy too. For example, if you do, start taking over-the-counter medications that you see at, your local store, and all of a sudden the pills stop working. Well, we can escalate therapy in terms of nasal sprays or some other interventions, but there's always more that you should look and talk to your doctors about to treat the illnesses.
Okay, now here's one specifically about something allergy-related pill-wise that they've been taking for years. This caller from Midland, if you take a 24-hour allergy pill for years, daily, over time, is that bad for you, or do you have long-term effects?
And that's exactly the kind of question we were talking about. Usually the over-the-counter medications in terms of antihistamines are very, very safe, and they can be taken on a regular basis. The pure antihistamines. Now, if you do take antihistamines that have a decongestion or pseudoephedrine, and those are the ones that have the D after them, long-term studies have shown that that can lead to increased blood pressure, and as Dr. Calliphora and I will both agree, increased blood pressure over long periods of time can lead to stroke. So it's not something that's going to hurt you in the next 5 or 10 years, but looking, 30, 40 years down the line, it could be detrimental to your health. So we try to keep you off of those medications, but pure antihistamines, those 24-hour ones, are good.
Okay, excellent. Now, Dr. Calliphora, this caller is from Big Rapids, and their question is about ocular rosacea. What is that, and are there any treatments for it?
I'm not a dermatologist, so I don't really know a lot about ocular rosacea.
Okay.
Rosacea is generally an erythematous rash which appears in the face. A lot of times it's treated with a cream, but I think that question would be better for a dermatologist, and maybe should be seen by a dermatologist.
Okay, thank you. A female who is 85 years old calling from Lake Fenton. Looks like her bones and muscles ache 2 weeks after receiving a pneumonia shot. Is there any way to tell if the shot was the cause of her pain and aches that she's having right now?
So in immunology, I use the pneumonia shot a lot to determine whether the patient's immune system is actually working or not. Okay. So I look at their immune system before they get the shot, then I look at it after they get the shot, and depending on what their levels are, we can determine whether their immune system is working. If you do make the immune system work, sometimes it can affect other areas of the body, including muscles and joints and things like that, that she might be experiencing. But then again, it could be multiple other things, and she should probably be evaluated by your primary care just to make sure it's not something more harmful.
Okay. Here is a medication question for you, Dr. Calliphora. Metformin, does it actually lower blood sugar?
Actually, yes, it does. It doesn't lower blood sugar more than, it doesn't usually lower blood sugar at a dangerous level. Metformin works mainly by decreasing new glucose production by the liver, but it's one of the medications which doesn't cause the so-called hypoglycemia effect, where people go unconscious when the blood sugars are really low.
Okay, thank you. Dr. Horrible, can you touch a little bit on food allergies for us?
That is a very broad question.
It sure is.
Food allergies are becoming more prevalent. We are seeing that more and more in the population, where if you grew up, I was in Midland in the 80s, and we never had issues with peanuts and peanut tables, but now you see children at peanut tables and having to avoid things and carrying EpiPens in school. It's becoming more prevalent, and it's concerning because we don't know why. Children, adults, anybody that's having some sort of a gastrointestinal reaction to some sort of food that they think could be causing an issue could be a slight food allergy. And what we do is, again, back to that original testing. In this case, we can put drops of food on your back in this case and see if you actually have a reaction. We use the skin as a template to see what exactly is happening inside the body. So if I say, for example, take some peanut and I put it on your skin and you have a little red dot on your back, that same kind of reaction could be happening in the intestines, and that could be what's causing the issue. Again, each individual food question needs to be answered on a per person basis, and it changes from person to person. But testing is absolutely available for anything that you eat. Okay,
thank you very much. This caller is from Shields, and she's asking if you are diabetic with neuropathy in her feet, will alpha lipoic acid help or not? I'm not sure if I'm pronouncing that properly.
It's fatty acid they're talking. Actually, there's no evidence that particular substance helps. Neuropathy is mainly treated by controlling the diabetes better, but there are some medications to help with the symptoms. That is the main way of managing diabetic neuropathy.
Here's another diabetes-related question. Is there a correlation between diabetes and high blood pressure other than obesity?
Actually, we call it the metabolic syndrome. We really can't say there's a correlation, but a lot of times these two diseases run together. So if you take 10 diabetics, I would say 8 of them would be hypertensive or have high blood pressure too.
Here's another a generic health-related question for you, Dr. Calliphora. Looks like our caller from Drummond Island tends to lose his balance a lot, specifically when he's in the shower and his eyes are closed. What do you think might be causing that sense of balance loss?
It could be anything actually. So balance is a very complicated mechanism actually. It can be an ear problem. There's a condition called benign paroxysmal positional vertigo. It's basically there's a crystal formation in the inner ear. So you get dizzy when you turn the position of your head. Sometimes a spinal cord problem can cause balance problem. There is a tract in the spinal cord which takes care of the balance or takes care of the proprioception or a sense of position of the legs. So it's very difficult to pinpoint to a diagnosis with such a broad symptom. I would recommend this patient to go and see her doctor actually and get evaluated.
Courtney, actually in allergy we see that as well. So if you do have increasing drainage from your nose, sometimes it can back up. It can actually push on those eustachian tube and those semicircular canals like Dr. Calliphora was talking about. In allergy, if we see that, you can get dizzy, you can get ringing in your ears and all kinds of symptoms. So if you do have really, really bad allergies, and it can cause those types of symptoms too. But in this case, this gentleman should always be worked up for something inner ear, something that could be pretty bad in his inner ear, especially if he closes his eyes and that happens. So he should really go see his primary care and possibly have a scan of his head just to make sure everything's okay.
Excellent. Thank you to you both. Now, believe it or not, we only have a few minutes left in our program, and we have quite a few questions that we have not been able to get to tonight. So right now, if we could kind of rapid fire through some of these to get to as many answers as we can, and then these two gentlemen will be staying with us after the show is over and answering some more of the questions that we won't be able to get to just now, and we'll be putting up their answers on our Facebook page. So make sure to check that out tomorrow, facebook.com/askthespecialists. Right to it. Ready? Rapid fire. Can anything be done to help with recurrent colds and infection to prevent them from recurring?
No.
You can have your immune system looked at to see if there's an immune deficiency going on.
Yes, that would be the right answer.
Okay. This caller from either Felton or Fenton's concerned that they have a cyst on their liver and pancreas and kidney. They said it was benign. Should I be on some type of antibiotic for it?
No.
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 A caller from Gaylord, idiopathic pulmonary fibrosis. He's seeing a family practice doctor. He's wondering if family practice is the right person to see for this, or if he should switch to internal medicine.
No, she should be seen by a pulmonologist who is specialized in idiopathic pulmonary fibrosis, yes.
Okay, so a pulmonologist. This 45-year-old male from Shepherd is asking if alcoholism is an allergic addiction.
It is not.
It is not. What might it be?
It could be family history, personality, quite a different things, but it's not an allergy. Absolutely not.
Okay. This viewer from Boyne is a 75-year-old female. Her question is concerning diverticulosis. Wants to know what to avoid and what to do when you start hurting.
There is no evidence that avoiding any kind of food prevents diverticulitis. So I'm sorry I can't answer that, but there is no evidence of any food relation with diverticulitis.
Okay, okay. This question is coming from Bay City. It looks like he has a bitter taste in his mouth. What could be causing this? Could it be the medications he's taking, antivert, or kidney problems?
It could be anything. That's a very broad, it's a symptom which can have multiple systems involved.
One case we did see in Cleveland was a vitamin deficiency, so he should probably talk to his family doctor. Maybe they can check his vitamin levels.
Okay, and then real quick, one last question coming in from Mansalona. What causes trigger finger, and what's the treatment for it?
Trigger finger is basically a nodule formation in the tendon which goes through a sheath and it gets stuck there. Treatment is a steroid injection, sometimes surgical repair.
Okay, yeah. Excellent. And there we go. The time has flown on by. Thank you both so much for being here tonight and answering our viewers' questions.
Okay. Thank you very much.
Really appreciate it, Dr. Horrible and Dr. Calliphora. We'd also like to thank our phone volunteers. We have Sherry, Tracy, and Megan all from Mid-Michigan Health. Thanks to those ladies for coming in to answer your calls tonight. Just as a reminder, please check out facebook.com/askthespecialists for a few of the questions that we could not get to in this live program. We'll be putting the answers on there tomorrow. And we hope that you can join us next week for our season finale. We will be asking the gardeners. I'm Courtney Jerome. Have a great night.